Causes, symptoms, and prevention of low testosterone in men. 1. Age. Testosterone levels naturally decrease with age, usually starting after age 30, decreasing about 1–2% per year. 2. Pathology. Pituitary or testicular disorders. Type 2 diabetes, obesity, metabolic syndrome. Kidney failure, liver failure, or other chronic diseases. 3. Unhealthy lifestyle. Lack of sleep, prolonged stress. Poor diet, especially zinc and vitamin D. Alcohol abuse, smoking. Lack of exercise or overexercise. 4. Environmental factors. Exposure to endocrine-disrupting chemicals, such as BPA and plastics. Side effects of certain medications, opioids, corticosteroids. 5. Genetics. Some people are at risk of low testosterone due to genetic factors. Symptoms of testosterone deficiency. 1. Physical. Decreased muscle mass, increased body fat. Fatigue, decreased endurance, loss of energy. Decreased bone density, osteoporosis. 2. Sexual. Decreased libido. Erectile dysfunction. Decreased sperm count and quality. 3. Mental. Depression, irritability, difficulty concentrating. Loss of confidence, decreased motivation. 4. Other signs. Hair loss, dry skin. Sleep apnea or insomnia. Hot flashes or sweating. How to prevent testosterone deficiency. 1. Maintain a healthy lifestyle. Exercise regularly. Prioritize weight training, high-intensity interval training, HIIT, 3 to 4 times a week to stimulate testosterone production. Get enough sleep. Sleep 7 to 8 hours every night. Avoid staying up late. Control stress. Practice meditation, yoga, or relaxation techniques. 2. Diet. Supplement foods rich in zinc, oysters, red meat, pumpkin seeds, vitamin D, salmon, eggs, sunlight, and healthy fats, avocado, olive oil. Limit processed foods, sugar, and trans fats. Drink enough water, avoid alcohol abuse. 3. Control weight. Reduce excess fat, especially belly fat, because obesity increases the aromatase enzyme, which converts testosterone into estrogen. 4. Avoid harmful agents. Limit exposure to toxic chemicals, plastics, pesticides. Do not arbitrarily use drugs or stimulants that can affect hormones. 5. Regular health checkups. Check testosterone levels if there are abnormal symptoms. Consult an endocrinologist or andrologist for timely advice and treatment. Thank you for watching the video. Wish you and your family health and happiness.